Imagine you're staring down a $50 cancellation fee just because your biological cycle decided to arrive a day early.
Oh, yeah, that is incredibly frustrating.
Right. Like you're booked for this intimate energy-based treatment, maybe a laser session or, radio frequency, and suddenly you are frantically Googling a question that you might be entirely too embarrassed to ask your doctor.
Or even just the clinic receptionist.
Exactly. You're trying to figure out, can you actually undergo these procedures while you are menstruating? So, welcome to today's deep dive where we are getting into exactly that.
And it's a question that, honestly, sounds like a pure logistical headache at first.
Yeah.
But the answer is a massive rabbit hole.
Oh, for sure. We have a huge stack of sources today to definitively answer this. We're looking at clinical FAQs, medical spa cancellation policies, severe safety warnings from the FDA, and even a massive observational study from Japan.
Because digging into this doesn't just tell us whether you should, reschedule your Tuesday appointment.
No.
It really forces us to look at the intersection of medical laser physics,
Mm-hmm.
the biological reality of tissue regeneration,
And a highly controversial industry, right?
right, a rapidly expanding industry built entirely around female reproductive health,
Mm.
which is operating in a very strange space right now.
Yeah, I mean, there seems to be this massive disconnect between the glossy marketing these clinics use and the intense, localized thermal physics these devices actually employ on the body.
Absolutely. So let's look at what the clinics actually tell you when you call up and say, hey, I'm on my period, can I still come in?
The answers are wild because they completely depend on the geography of the treatment, right?
Exactly.
So if you were looking at external procedures like laser hair removal on the extended bikini area, places like Suddenly Slimmer Med Spa and Urbana essentially say, yeah, no problem.
Right. They just tell you to use a tampon or menstrual cup for hygiene during the session.
But they enforce that strictly. If you don't use internal menstrual products, you have to reschedule.
And this is where that $50 cancellation fee at the Suddenly Slimmer comes into play.
Yeah.
If you give them less than 24 hours notice.
Which is crazy. You are put in this bizarre position of trying to perfectly predict your endocrine system just to avoid a financial penalty from a med spa.
Is super stressful.
Yeah.
But if you take a tampon out of the equation, because we were talking about internal mucosal treatments, which are often marketed as vaginal rejuvenation,
Right.
well, then the answers start to splinter. Take Thermiva, for example. It's a very popular radiofrequency treatment.
Yeah, and the Glow Aesthetic Center explicitly claims that Thermiva is, quote, safe at any stage in your menstrual cycle.
Their logic there is that the radio waves don't interact with your hormone balance, and they don't alter your menses. Therefore, no risk.
I mean, from a purely endocrinological standpoint, sure. The device isn't systemically altering the biological process of your period.
Right. The machine is just emitting localized thermal energy. It isn't, traveling up to your pituitary gland and changing your hormone production.
But focusing solely on the machine's safety profile completely ignores the physiological reality of the patient lying on the table. Like, just because you can doesn't mean you should.
Exactly.
These lasers rely on controlled thermal damage. Doing that to tissue that is already actively inflamed during menstruation sounds completely counterproductive.
Victoria House Clinic actually brings this up. They note that during your period, your pain threshold significantly drops.
Oh, because of the prostaglandins.
Yes. You have systemic prostaglandins flooding your body. So you got cramps, bloating, and heightened pain receptor sensitivity. You are chemically sensitized.
So a treatment that's calibrated to feel like a deep, warm tingling on, say, day 14 of your cycle.
Might feel intolerably hot or sharp on day 2. The patient's subjective neurochemical reality matters just as much as the objective output of the machine.
Ignoring that drop in pain threshold is, frankly, bad clinical practice, even if the device itself isn't going to disrupt your overall cycle.
Absolutely. And once we move from the subjective pain into the objective physics, that technically safe argument completely falls apart.
Because a tampon obviously blocks the internal canal, meaning you can't use one during an internal laser or radiofrequency session.
Right, so you are dealing with active bleeding. And suddenly, clinics aren't just saying, well, maybe reschedule if you're crampy.
Yeah, Bangkok Hospital highly advises waiting, and the American Med Spa Association specifically lists menstruating women under contraindications for radiofrequency procedures.
A clinic named Invicta, they do thread reconstruction in that area, and they state outright the procedure simply cannot be performed.
Wow. Why so strict?
Well, at the most basic level, as the Women's Health Clinic points out, active bleeding obscures visibility for the practitioner.
Oh, that makes sense. You are firing a laser in a highly vascular area.
Exactly. If the practitioner cannot clearly see the mucosal walls, the risk of accidental burns or uneven application just skyrockets. Plus, there is a markedly increased risk of infection when introducing a wand into the canal during active shedding.
But the clinical literature for VIV, which is one of the major radiofrequency devices, points to an even bigger problem. It's not just about visibility.
Oh, it's not. The blood itself fundamentally breaks the physics of the treatment.
Okay, walk me through that.
This is where we have to look at tissue impedance. Radiofrequency relies on the natural electrical resistance of your tissues to generate heat.
Right.
It is carefully calibrated to penetrate through the superficial mucosa and hit the deep connective tissue underneath, which is known as the stroma.
Which makes total sense. But blood is packed with iron and water. It is highly conductive.
Extremely conductive.
So if you introduce a layer of highly conductive fluid between the wand and the tissue, it's like trying to use a flashlight in a foggy room. But honestly worse, because the electrical current just takes the path of least resistance right through the blood.
Yeah, taking your foggy room analogy further, the fog doesn't just scatter the light, it absorbs it. The blood short-circuits the radiofrequency pathway.
So the thermal energy gets absorbed by the pooling blood rather than penetrating the vaginal walls.
Exactly. So you're sitting there paying thousands of dollars out of pocket, enduring heightened pain because of your hormonal state, all to effectively just heat up a layer of menstrual blood.
While the deeper collagen architecture you're actually trying to treat remains completely unaffected, that is wild. You are actively compromising a massive medical investment.
You really are. And while we're talking about the relationship between these devices and bleeding, there's a pervasive myth we need to put to bed.
Oh, right. Gynecology Associates of Gwinnett addresses this. They have patients who come in terrified that a laser treatment like FemTouch somehow caused their period to be late or induced abnormal bleeding.
We have to firmly separate correlation from causation here. If you experience a late cycle after a fractional laser treatment, the localized thermal energy did not disrupt your endocrine system.
Right, because, again, it's a localized burn, not a hormonal override. If your period is late, they point out you need to look at underlying systemic factors.
Like, are you under immense stress? Have there been changes in your birth control?
Or could it be an unmanaged condition like polycystic ovary syndrome, PCOS, where hormonal imbalances cause irregular ovulation? The laser is really just a bystander to those systemic issues.
Precisely. But this brings up a really crucial question.
Yeah.
If the physics are so easily derailed by a period, and if the pain threshold is such a factor and the cost is astronomical, why are so many women navigating this?
That is the big question. What is driving someone to meticulously track their cycle just to undergo a vaginal laser treatment?
To understand that, we have to look at what they are actually trying to treat.
Right. Because our audience is pretty well informed, we don't need to re-explain the basics of what a CO2 laser is.
We know the difference between ablative lasers that vaporize superficial tissue and non-ablative radiofrequency that uses deep heat.
But the application here is highly specific. These devices are being targeted at genitourinary syndrome of menopause, or GSM.
And GSM is a chronic, deeply intrusive, progressive condition. It is fundamentally caused by a steep drop in systemic estrogen,
Which encompasses a massive spectrum of quality of life destroying symptoms.
We are talking about severe vaginal atrophy, the physical thinning and drying out of the vaginal walls. There is profound dryness.
And dyspareunia, right, the medical term for severe pain during intercourse.
Yes, along with mild urinary incontinence and a loss of structural integrity.
So the goal with an ablative CO2 laser isn't just to, warm the area up. You are intentionally creating controlled micro-injuries in the stratified squamous epithelium.
That multi-layered protective lining of the tissue, yes. You are harnessing the body's innate biological trauma response.
Okay, so by vaporizing those microscopic columns of tissue, you trigger a massive wound healing cascade.
Exactly. The body detects the damage and sends chemical signal cytokines flooding into the area. This stimulates fibroblasts, which are the cells responsible for structural framework, to rush in and synthesize brand new collagen.
So we're essentially tricking the body. Because of the drop in estrogen, the body had stopped maintaining this tissue. It basically shut off the maintenance budget.
That's a great way to put it.
By aggressively damaging it with a laser, you force the body to rush in, allocate resources, and rebuild an area it had abandoned. This process of neocollagenesis.
And we have remarkable data demonstrating the physical reality of this biological trick. The observational study published in Frontiers in Reproductive Health is just a goldmine here.
Oh, the one from Japan.
Yes, they tracked a massive cohort in Japan, 826 women who collectively underwent 2,129 sessions of fractional CO2 laser therapy.
Having an N value over 800 for a novel procedure like this provides significant statistical power.
It really does. And they didn't just ask the women how they felt, they actually measured the tissue regeneration.
Right, they used ultrasound to objectively measure the thickness of the labia majora before they started the sessions and after they completed them.
The ultrasound data showed a measurable, undeniable physical change. The tissue thickness increased from an average of 16.9 millimeters to 18.9 millimeters.
Which, an increase of 2 millimeters might sound tiny to some people, but when you are talking about mucosal lining and the underlying stroma that's responsible for elasticity and comfort.
2 millimeters of brand new vascularized tissue is a structural revolution for that area. It fundamentally changes the biomechanics.
Wow.
But the subjective data, how the women actually felt, reveals a fascinating limitation of the technology. The symptom relief varied wildly depending on what was being measured.
I remember this from the sources. The relief from dyspareunia, the pain during sex, showed incredible durability. Those patients reported improvements lasting up to 10 to 14 months after their final session.
But the relief from vaginal dryness and the relief from urinary leakage attenuated much faster. They faded way before the year mark.
Which perfectly illustrates the difference between structural repair and hormonal function.
Exactly. Dyspareunia is largely a mechanical issue linked to the deeper collagen and elastin architecture of the vaginal wall. Because the laser physically thickened that deeper structural stroma, the pain relief lasted as long as that new collagen survived.
Over a year. But dryness is different. Dryness relies on superficial mucosal hydration and local glandular secretions, and those are critically dependent on systemic estrogen.
And the laser doesn't fix your estrogen deficiency.
No, it forces a temporary rush of blood and moisture during the healing phase, but once that wound healing cascade settles down, the lack of estrogen means the dryness inevitably returns.
And urinary leakage is an even more complex mechanical failure involving the urethral sphincter and the deep pelvic floor muscles.
So a superficial laser treating the mucosal lining cannot entirely rebuild a failing pelvic floor.
No, it is a highly targeted tool for collagen generation, not a magic wand for all menopausal symptoms.
Which brings us to the most jarring pivot in our deep dive today.
Yeah.
We have ultrasound data showing a 2 millimeter increase in tissue. We have hundreds of women reporting a year of relief from debilitating pain.
Yeah.
So why do the most prominent medical regulatory bodies in the world strongly advise you to stay far away from these devices?
The medical debate here is fierce, and it really hinges on the massive gap between localized clinical success and long-term, large-scale safety data.
Right, because in July 2018, the U.S. Food and Drug Administration issued a severe safety communication. They explicitly warned against the use of these energy-based devices for vaginal rejuvenation.
And the FDA made a very specific point to tear down that phrase. Vaginal rejuvenation is not a medical diagnosis.
It's an ill-defined, glossy marketing term designed to sound like a spa treatment.
It completely masks the reality of the procedure. The FDA stated unequivocally that safety and effectiveness have not been established for these off-label gynecological uses.
Because these lasers were actually cleared by the FDA for destroying precancerous cervical or vaginal tissue, destroying bad cells, not rejuvenating healthy ones.
Exactly. And the risks the FDA highlighted in that warning are horrifying if you think you were just going in for a quick tune-up.
Yeah, they cited serious adverse events, including severe burns, permanent scarring, chronic agonizing pain, and vaginal agglutination.
And vaginal agglutination is where the thermal damage is so severe and the subsequent wound healing is so uncontrolled that the opposing walls of the vagina actually fuse and heal stuck together.
Which is just an absolute nightmare scenario.
It really is. And it's not just the FDA. The American College of Obstetricians and Gynecologists and the Royal College of Obstetricians and Gynecologists in the UK stand shoulder to shoulder on this.
Right. They state these energy treatments should not be routinely offered outside of controlled clinical trials.
And they stress that for issues like urinary incontinence, standard pelvic floor physiotherapy is the medically proven first line of defense, not an off-label laser.
However, we have to look at all the sources, right? Including the data driving the pushback against the FDA.
That's right, because when researchers conducted independent reviews of the FDA's own MIUD database,
that's the Manufacturer and User Facility Device Experience Database, which tracks adverse medical device reports.
yes, the numbers painted a slightly different picture. Out of hundreds of thousands of these procedures performed globally, the actual reported instances of those severe adverse events, the severe burns and agglutination, were statistically very infrequent.
Which leads a lot of clinicians to argue that the FDA's blanket 2018 warning was heavily paternalistic.
They argue it creates a stigma that prevents patients from accessing a therapy that, while off-label, is providing profound relief with a relatively low complication rate when performed by a skilled practitioner.
But that begs the question, why risk an off-label, potentially burn-inducing device at all? Why not just use the standard treatments?
Well, the answer is that a massive segment of the population isn't allowed to use them.
And this is the real crux of the demand. These treatments are aggressively sought after by women who are medically barred from traditional hormonal therapies.
The most poignant example is breast cancer survivors.
Yeah. The systemic treatments for breast cancer often act as an immediate sledgehammer to the endocrine system. They induce sudden, severe medical menopause.
You are plunged into the deepest end of genitourinary syndrome of menopause overnight. But if your breast cancer was hormone receptor positive, meaning estrogen feeds the cancer,
Your oncologist will strictly forbid you from using topical estrogen creams to treat the resulting vaginal atrophy.
so you survive breast cancer, but your reward is debilitating chronic tissue pain. And when you ask your doctor for the standard treatment, they have to say no because it could bring the cancer back.
The absolute desperation that creates is unimaginable.
Ah.
Of course you are going to seek out an alternative. If a med spa offers a laser that doesn't use estrogen, you are going to take that risk.
And there it is. You have regulatory bodies rightfully demanding 10-year, double-blind, placebo-controlled trials before they give a stamp of approval, because their mandate is to protect the public from predatory marketing and horrific burns.
But on the other side, you have a massive population of women dealing with chronic atrophy who feel completely abandoned by traditional analog medicine.
They cannot wait 10 years for a clinical trial to finish. They need relief today, and they are finding it in these novel technologies.
So, to bring this all the way back to the incredibly specific question we started with for you today, can you undergo these intimate energy treatments while you are menstruating?
For external hair removal, yes, provided you use internal hygiene products and are willing to weather a lowered pain threshold. But for internal procedures targeting mucosal tissue, the answer is a definitive clinical no.
It won't disrupt your hormones, but the physical presence of the highly conductive blood volume will essentially short-circuit the radio frequency or block the laser, rendering a very expensive, very painful procedure clinically useless.
Furthermore, anyone stepping into this world really needs to pierce through the rejuvenation marketing.
Yeah, you are dealing with powerful, off-label lasers creating controlled trauma, carrying rare but severe risks that the FDA is actively warning against.
Which leaves us with a critical paradigm shift to consider. We are watching a fascinating, almost dangerous friction unfold in real time. We have an analog regulatory framework agencies like the FDA that require slow, decade-long trials to prove safety.
But they are colliding with a digital era pace of technological iteration, driven by immense patient demand. The patients are refusing to wait for the red tape.
Exactly. When a massive demographic feels their pain is ignored by the traditional medical establishment, they will bypass the establishment entirely. They're effectively turning themselves into a massive, unregulated, out-of-pocket clinical trial in the gray market of med spas.
Which is a lot to think about.
It forces us to ask, how must our medical regulatory bodies evolve to protect patients when the patients themselves are actively choosing the risk of an off-label laser over the certainty of untreated pain?